It's really enjoyable being able to be close to work, being close to family, and being able to make activities that you find important to yourself.
For most physicians, it's very, within a few minutes you're in the hospital.
I would refer specifically to my obstetrics unit here because I have worked in very close contact with all of them, and I think we have one of the best of the staff that you could ever think of. All right, these are all very young, dedicated people who are ready to learn, and being so concise in the sense that we are on the small side, all of us know each other's capabilities, and we all learn together. And in fact, they are the best that you could ever think of.
Working with the staff at Hillsdale Community Health Center, they're great. I mean, they're up to date on all their information in regards to how to do certain techniques, how to work with the physicians.
Our staff is very knit tight. We work well together as a team. They're very knowledgeable, they're receptive to learning more and new technologies, which I have brought into this community, which they've been very receptive of. I think everyone wants to learn, they want to work well together, and we seem to do that in a very, very good manner.
Hillsdale Community Health Center is dedicated to excellence in healthcare, community service, continuous improvement, and respect for human life. We serve the health needs of our local community through compassionate and highly skilled care in our clean, safe, healing environment. Hillsdale Community Health Center is a small but progressive rural healthcare facility located in south central Lower Michigan, just over an hour from metropolitan areas such as Detroit, Lansing, Toledo, Ann Arbor, and Kalamazoo. Hillsdale County is home to 47,000 residents who enjoy its 30 lakes, hunting, beautiful golf courses, and rolling picturesque landscape. Many people recognize our community as host to Hillsdale College, a nationally ranked private liberal arts college and cultural resource.
The town has a wonderful community theater and a children's theater. Our daughter was in a play. Just living right in the community that you work in really provides a good sense of family.
I'm an avid outdoorsman, so most things outdoors is what I like to do. It's changed a little bit because I like spending time with my two young girls now. But besides that, I'm an avid deer hunter, whitetail deer in particular, which is fabulous around this area in Michigan. Some waterfowl, lots of fishing, sailing, boating. There's many lakes and rivers, and everything that you can do outdoors is just fantastic.
Apart from the social activities of going to church, which my wife always blames me, I don't go to church enough.
Hillsdale Community Health Center has 47 acute care beds, 21 skilled nursing facility beds, and the 10-bed Dempster W. Muffet Center for Psychiatric Care. We are a technologically advanced health center, utilizing a 64-slice CT scanner and magnetic resonance imaging, state-of-the-art lab equipment for in-house diagnostics, and high-tech critical care and emergency departments. The health center's productive surgery department includes surgical suites and an ophthalmology suite, each equipped to perform the most complex procedures. Our third floor is dedicated to the Hillsdale Center for Joint Replacement, with 10 private suites for our orthopedic patients.
It's not uncommon for a patient to ask me, why'd you choose Hillsdale as a community to practice in? I've been in practice for about 15 years now, and 12 of those years actually were in Hillsdale. I started off in practice in Detroit, Michigan. I joined the trainers that trained me in ophthalmology. I worked for them for about 3 years, and we were working on partnership negotiations, and at that time it just didn't seem to work out. And a friend of mine who actually trained in the Detroit area also was in practice out here in the Hillsdale community, and called me up on the phone and said, Dave, I really need some help out here. I'm kind of busy and I just can't do it all myself. So I came out to help him out. I had a couple of flat tires on my way out, so I said, it's not for me, Joe. And so a couple weeks go by and Joe calls me up again and says, Dave, you got to try to come out here to Hillsdale. You'd really enjoy coming out here and working. So we made our venture out here and came out here, worked for him for 2 years, ended up buying his practice out here in Hillsdale and stayed here ever since.
I've always been more attracted to a small town atmosphere. I grew up in a smaller town. I've trained in both smaller communities as well in large institutions, and I prefer more of the personable approach and feel that I get in a small town community.
I was a chief resident back in Brooklyn Jewish Hospital, Interfaith, in New York. And we got a call which was directed to me in the operating room from the director's office. And the nursing director in this hospital was the one who had called. They had actually lost the original obstetrician gynecologist here who had moved on, so they were looking for a replacement. So they wondered if I would come and have a look at this place. In truth, I just said, okay, give me your telephone number and I'll call you back. But she said, no. You give us your telephone number and address. We'll mail a ticket to you. In your free time, please check us out. I put this ticket down for nearly 6 months without even touching it. And one time I felt very tired and I said, okay, let me go and find out about this Hillsdale area. They told me it was in Michigan. When they mentioned Michigan, all I thought of was cold weather. And it happened to be in winter anyway when I flew in. I got to the airport about 11 o'clock, and the map I had to this place was about a 2x3 inch type of map, and I had to drive through the snow all the way here. I got in town about 1 a.m. and the whole town was asleep. And there was a blanket of beautiful snow. I was able to find my way to the college where I was supposed to take a rest. Then in the morning when I woke up, it was the most beautiful sight. The sleep was a perfect sound sleep, and the morning was beautiful. I called Pat Lyden, who was the nursing director that I'm in town. She didn't even know I was coming. So she was excited, and we came and had a look around here. And believe it, it was a beautiful encounter. I told my wife about the place. We had various offers in Ohio and upstate New York. And when I told my wife about this place, she decided, okay, let's come and see it. And she fell in love with the place immediately. So we flew in the children, and they all said, Daddy, you stay here. And that's how I'm here. And I've been here for 18, going to my 19th year.
You look at the sign of Hillsdale as you drive in, it says, "It's the people." And the reason it is because those people, they're truly, honestly friendly, they're helpful, they're courteous, and we would just love to have you come on out, explore it, visit it for yourself, and really fall in love with the community. It's been a great place for us, and hopefully in the future for you too.
I would encourage whoever wants to come in, please do come in and stay. It is the most beautiful place you would ever get to work.